Hello, I'd like to introduce you to three approaches in complementary therapy that I find really rapid and useful that can be integrated easily into self-care for patients suffering from mental health problems like stress, depression, or anxiety, and can often help their mood. Remember, if you're already going through therapy, it's really important to speak to your therapist whether these techniques are appropriate for you. Because sometimes the therapists might want you to do these at a different time. But from my experience, they can be used really quickly and effectively while waiting. I'm an integrative health doctor, a GP, and I like to use techniques that are fast, effective, together with conventional medicine. And this sort of care is called an integrated approach to health. And all these techniques have been featured or will feature in the Integrative Health Convention that we organize with the College of Medicine every year. So the first technique I'd like to introduce to you is something called the Emotional Freedom Technique, or EFT. This is sometimes referred to as tapping. The video here shows Subir and Emma Roberts from the EFT Center in London teaching you how to do it. You can learn more from their website and from watching the technique here.
So we start off there and we say what's called a setup statement. And our setup statement embraces the problem that we're working with. So it could be anger, it could be a neck pain, it could be whatever, it doesn't matter what it is. And we put that within a particular statement, which goes, I'm going to give you the traditional setup statement, which is slightly American, but just go with us here. You don't have to believe it, right? So we go, even though I have, and I'm going to put this problem in here just generically, okay? Even though I have this problem, so if you want to follow me, even though I have this problem, here's the American bit, I deeply and completely love and accept myself. I deeply and completely love and accept myself. You're allowed to laugh. the full sort of setup says you do that 3 times. You'll find that we kind of moderate that as we go to get experience. But so we do that 3 times. Even though I have this problem, I deeply and completely love and accept myself. Deeply and completely love and accept myself. And once more, even though I have this problem, I deeply and completely love and accept myself. I deeply and completely love and accept myself. And taking a couple of fingers, we take out this problem bit, which we call the reminder phrase, and we repeat that on all the points. The first one being at the beginning of your eyebrow, either side of the face, it doesn't matter which. Some people double tap, it's up to you, whatever feels good. So this problem. Then on the side of your eye, on the kind of bony bit, this problem. Under your eye, again on the bony bit, this problem. Under your nose, this problem. On your chin, this problem. Collarbone, we say tap where you've not a tie, because everybody knows what that is. This problem. Under one arm, this problem. And on the top of your head, this problem. You take a deep breath in and out. Now you know the tapping sequence. That's easy, isn't it?
There are 2 other quick techniques that I have found very effective, both from experienced practitioners who you may even have heard of. One is Paul McKenna, who demonstrates something called the havening techniques. It's a wonderful approach to help stress, depression, anxiety, like I said, and even pain relief, and does a lot related to trauma. I'll insert a YouTube video down here which will explain that. And the last but not least of these techniques is the arrow technique created by a renowned hypnotherapist in the UK called Freddy Jacquin, which certainly works really well for pain and numerous other conditions. All you have to do is Google on YouTube the arrow technique, and not only will he talk you through this, and again I'll insert the video here.